This one's the approved list supported living services tender for working age adults. If your agency can provide supported living services, it's an opportunity you might want to consider. Not every tender is ideal for your business. Market engagement events help you to influence the council. This one's the approved list supported living services tender for working age adults. It's been run in and by East Sussex County Council. So if your agency can provide supported living services and you can do that in and within East Sussex, then this is an opportunity you might want to consider. Now, this framework's already been ongoing. However, the borough here has a pre-approved list of suppliers, which they've already established. However, as this framework has already been ongoing, they will reopen it periodically to allow for new bidders to join the framework. And this period is one of the periods where you can bid to be one of the approved suppliers. Although this is a supported living services as a whole, the service requirements here are broken down into two different categories. The first category here, or the first type of service, is mainly around accommodation-based support and care. And the second type of service is housing support. So two different types of services because the individuals will have different types of needs. So you need to ensure that you can provide either one of or both types of services. In terms of the individuals, the types of needs or the needs of the individuals would also vary. You would require to provide support for individuals who may have learning difficulties or learning disabilities. They may have physical disabilities, sensory impairment, long-term health conditions, or may have mental health needs as well. The tender is also broken down into categories and lots. There are 3 categories, and within each category there are 2 lots. So essentially we can call it 6 lots as a whole. They vary based on the needs of the individuals you're going to be providing support or care for. For example, in category 1, these individuals would require mental health support. So within category 1, because it's individuals with mental health support, require mental health support, it's broken down into 2 different types of services or 2 different lots. Lot 1A is a focus on housing support, because remember, 2 different types of services. One is focused on housing support and the other is accommodation-based care. So lot 1B is provision of personal care. And then in category 2, that's where you're providing support to individuals with learning difficulties. Again, 2A being housing support for individuals with learning difficulties, and 2B, personal care, and so on and so forth. However, the third category is individuals with physical disabilities and long-term health conditions. Again, this is going to be housing support focused or care focused alone. Are you required to provide accommodation? Bear in mind that because there are 2 different services here, accommodation-based care and support and housing support. Specifically for housing support, no, because you're only working to provide support for individuals who already have the housing provided for them. However, if you're providing accommodation-based care and support, keyword being accommodation, although you'll be required to work with landlords, you are not responsible for the ownership of the property. So in fact, you being the care agency, should not be the one who owns the property as well. You will need to work or source property from a private landlord, a social housing provider or property provider who is not the entity that is providing the care, which will be yourself. Then in terms of the pricing here, because again, before we get into regulatory requirements, we need to understand if this is a viable opportunity or not. The pricing has been updated every single year because again, bear in mind that this framework has already been ongoing for a few years already. Every year, they've been increasing the rates. However, a key thing for you to understand is that the rates as of today will be negotiated at the point of placement. So when you get the referral, when you're bidding for the package, you'll be able to negotiate for how much you're going to charge, what your fees are, what your rates will be per hour for that particular individual or that particular service or support you're providing. In terms of regulatory requirements, if you're providing personal care, you will need to have CQC registration, which means if you're bidding for categories 1B, 2B or 3B, your agency will need to be registered with the Care Quality Commission because they govern and regulate the provision of personal care in England. So you cannot provide care unless you have a license with the Care Quality Commission. Going on from that, if you do not have the license with CQC, you can bid for 1A, 2A or 3A because these lots or those categories do not involve personal care, just support, although you will need to have experience providing support and demonstrate your knowledge as well, which we're going to get into. However, even if you do have CQC registration and you can provide care, if you're bidding for 1B, 2B and 3B, again, you will need to have a CQC rating of at least good. So registration with CQC alone is not sufficient for those lots. You will need to have a rating with CQC too. Now, another key area for you to focus on to ensure that you're one of the providers that gets selected if you decide to bid for the tender is the technical requirements here. So this is where you need to demonstrate and evidence your capacity, resources, your knowledge, your experience providing the service to a high standard. Now, one of the focus areas in this category is around staff. So you will need to be able to demonstrate that your staff meets the skills for care code of conduct. Your staff have completed the induction, which is the health and social care induction and training. You also need to ensure that you can demonstrate that within the first 12 weeks, your staff have also completed the HSC training, as well as that at least 50% of your staff need to be working towards their QCF training. So that's the qualifications and credit framework. Beyond that, you need to ensure you can demonstrate and evidence your person-centered approach when your staff are working, when your agency as a whole are working with these individuals, supporting them with mental health, learning difficulties or physical difficulties as well. Now, there are various ways you can do that. One of the key ways is by giving your contract examples, utilizing case studies, which is essentially where you need to demonstrate or provide references for where you've delivered and continue to deliver support living services for these sort of individuals across any borough, or ideally also within East Sussex County Council. Then in terms of insurances, because this does catch a lot of agencies off as well, you will need to ensure that you have the relevant insurance. By relevance, you need to focus on two things: the type of insurance. So on this one, you need to have public liability insurance and employer's liability insurance. Then secondly, the coverage amount. So this needs to cover at least 5 million. So not just having employer's liability and it covering 2 million, you need to have employer's liability and ensure that it covers at least £5 million as well. Then you need to ensure that your staff have DBS clearance. So up-to-date DBS checks are done every 3 years according to the standard of this tender, because you will need to demonstrate that as well. Then in the financial standing assessment, which is essentially where you need to demonstrate that your agency are financially stable and healthy and do not present a risk to the organization or to the council on this tender. They will conduct two tests. The first test, you need to score a minimum of 200. And the second one, which is a self-certification, you need to score at least 170. Now, bear in mind that these tests are conducted based on the annual contract value of £25,000. So again, depending on what sort of information or documentation you present, which could be your accounts, it could be, you might utilize a parent company, you might utilize other alternative provisions. So you might have letters, references, you might be able to utilize loans or financial projections and forecast. There's a list of different things and different types of evidence you can present to demonstrate that your agency is not a financial risk to the buyer on this tender. Then last but not least, in order to pass and be an approved supplier, you will need to also respond to the project specific questions. These are questions where you will need to demonstrate your experience and your knowledge. If you need help with any of these questions or submitting your bid in general, the contact details are in the description. However, before we even get to these questions, make sure you have everything else we've talked about. So that's your insurances, your CQC registrations, your financials. Everything needs to be in place first before you consider bidding and not responding to the questions. Again, if you need help, check the descriptions, contact details are there. If you want to access the link to the tender directly, again, in the description, you can see the link to BidSuite, where we have the portal and the files there for you to download and respond to the bid.